This is our regular monthly radio show with the Glencroft Center for Modern Aging. It's called, appropriately, Modern Aging. With us today is Deborah Koval. She is the Director of Clinical Operations for something known as Curana Health, and they deal in the health and well-being of people who are here at Glencroft and 35 other facilities in the Valley. Deborah, tell us, for the uninitiated, specifically, what is Curana Health?
Yes, Curana Health is a primary care. We specialize in geriatric medicine. So we deliver care to the facilities and communities on site. We are lucky enough to have a clinic here on site at Glencroft. We as well do in-home rounding. So we can see residents in their home if they're not feeling well or are considered homebound. So we're able to see those in all levels of care here too. So we can go on site for residents that live in memory care or assisted living, or those that have difficulty getting out of their homes. Or for those who prefer to have that normal day-to-day encounter, we're able to see them in the clinic as well. So we're very happy to have the residents come on site and see us there.
Now, as I understand it from our pre-interview, that for somebody who is in independent living, their needs are not as significant, perhaps, as somebody who is in assisted living. So with somebody in independent living, you would see them every 3 to 6 months. With somebody in assisted living, you'd see them every month.
So I wouldn't say independent is insignificant whatsoever. So of course we always state that, all care is significant on any primary care behalf. So yes, independent living residents, of course, are usually healthier. Mm-hmm. And so they don't need as much of that oversight, though we are able to provide that on an as-needed basis. So if a resident does have that preference or that need, we are able to see them more often as needed too. Though we know that if that need is not there, we prefer to follow up within that 3 to 6 month mark for independent living residents. And that's because we want to prevent hospitalizations first and foremost. We also want to make sure that we're collaborating care with their other specialists. If they have a cardiologist that we need to read that report on, if they were on a new medication, we want to make sure that we have that updated in our system. And those assisted living or memory care residents, we know that they may need more additional oversight in their care. So we do try to round more often, specifically in that community. So a monthly basis is that minimum that we try to strive to follow up on that care need. Now, that may be more often if we're making a medication change or see additional need of care. We might be rounding more often than that too, to ensure that they stay out of the hospital to prevent those excess costs.
And there are things that can show up. For instance, in a blood test, there is something that if you're not having blood tests done, then nobody will know that something is creeping into your physical condition. Is that right?
Right. So we want to make sure that we're routinely looking at the person as a whole. We want to conduct those routine blood work tests, and we can find many things. We can kind of read you like a puzzle when we put your blood work together. So depending on your condition, labs are ordered based on that need of care. So it's very individualized.
Oh, for sure. How healthy is the typical person when they come here as in independent living versus someone who is in assisted living? Definitely there's some aging going on, but how healthy are they, and what do you look for?
Sure. And, with all levels of care, sometimes you just don't know what you're walking into. We have seen many different scenarios here, but normally independent living residents are able to assist in managing their own care. They're usually able to follow up with outside specialists or, make those appointments to help coordinate their care in their home, or their loved ones do assist them with that too. Independent, they're usually mobile, able to move a little more. and have more of that independence. In that assisted living environment for that care, they may have more hands-on assistance. Maybe they have a power of attorney or a dedicated loved one that helps coordinate their care, or the facility level as well that may help identify that need or have that extra helping hand to help with those activities of daily living.
Now, you have a clinic here. Is that the right way to refer to it?
Yes, we have Curana Health has a primary care clinic here on site.
So with that being here, if somebody isn't feeling well, they can reach out to you that day.
Yes, essentially they can. So we are primary care. We do have usually a full schedule of residents that we routinely want to see by schedule appointment. Though if there is additional residents that have that walk-in, we do try and reserve some additional appointments to ensure that we can have that person seen. Of course, for whatever reason we can't fit in for the same day, we want to initiate that care need. So you can always call for saying, I have a new symptom, I have a concern. This gets directly relayed back to our provider so that they can initiate care. Let's say if it's a test that we need to do or an initial antibiotic that we need to prescribe, and then we want to follow up on that care immediately on our next available appointment for whatever reason if we can't get in the same day. But usually we're able to accommodate that.
This is Bill Brady on the Pulse of Arizona, 1100 KFNX. Deborah Koval is with us. She is with Curana Health, and they administer all of the primary care to people at the Glencroft Center for Modern Aging. What do you do in the area of being proactive in regard to somebody's health when you have these examinations? What are you looking for, and what do you do in regard to being proactive?
Of course. So proactive care, we want to make sure that we're following up frequently. So ensuring that we have that communication, develop that rapport and relationship with not only the resident, but also, family members too, especially if they're overseeing the care of identifying the needs of care. So we want to make sure that we are seeing the patient and identifying any of those care needs.
That must be reassuring for the families to know that it's not a case of where there's just somebody who would be the point person, but there's actual primary care that is in the Glencroft facility that is available to them every day of the week and 24/7 support around the clock.
That's correct. Yep, 24/7 by call. So we do staff our own nocturnist team. We have providers that are available on call, dedicated with Curana Health, nights, weekends, and holidays to answer that phone call.
Now, your partners have seen a 39% reduction in hospitalization. Now, you mentioned that earlier as being one of the goals of your treatment to prevent hospitalization. Give us an example of what would happen to somebody if you weren't there, if Curana was not there doing these examinations on a monthly basis. What kind of things could creep in that would result in a hospitalization?
Right. There may be unidentified things. So, Curana Health is able to identify early symptoms when we follow someone more closely. So we can easily see if maybe there's been some sort of disorientation or changes to that behavior. And we're able to prevent those hospitalizations. Now, residents, maybe they are waiting a long time to get in to see that primary care, or they go without care altogether, or it becomes delayed in their care and becomes an expensive hospital visit. So Curana Health takes that proactive approach for primary care to help keep residents out of the hospital and to age healthy in their homes.
You do have a significant success story involving a patient who couldn't get an appointment with their primary outside, but they were able to, through Curana, they were able to get the help that they needed.
That's correct, yes. So Curana Health is available as secondary care as well. So if there is an outside primary care, as long as we're not seeing on the same day for the same service, we're able to provide this care for the residents. And so we're able to see this resident more sooner. We're able to come in same day to see this person, which ultimately prevented an ER visit from happening. So we're able to, diagnose early infection. We were able to prescribe antibiotic medication. We were able to send a report to the specialist that was following that resident to ensure that was communicated forward for their care. And it was a great experience for that individual to have so that they wouldn't have to go to the hospital. They can stay in their home. Was very ease of service to have that care brought to them specifically.
Now, there's the physical aspect of healthcare, but there's also the emotional and social well-being of people, especially seniors who have their own set of challenges. How does Curana work with seniors in terms of their unique needs?
Of course. So again, grounding more often, getting to know you as an individual. So we know senior care, there may be many conditions, or there's a few very lucky ones that maybe don't have very many conditions. And we want to know you as an individual. So we don't want senior care residents to have the concern of feeling overwhelmed. We want to make sure that they are aging in place. So we're going to coordinate care and bring those aging in place services to the residents just as we provide as well. If that's a referral for a specialist, if it's helping answer any questions in regard to their care and general emotional well-being. So we want to make sure that residents feel valued, that they feel heard and supported. It's just a meaningful way to connect with your medical provider as well.
Emotional well-being is very important. Remember a New York Times headline in Science Times, it was probably 100 years ago, said, "A feeling of control is essential to emotional well-being." And it seems as if with what Curana provides here at the Glencroft Center for Modern Aging, people have a pretty good amount of control over their health care and their well-being. Deborah Koval, good to meet you today. Deborah is with Curana, the primary care provider for people here at the Glencroft Center for Modern Aging. Thanks for being here.
Thank you very much. I appreciate your time, and Curana Health is very happy and lucky to serve care here to the residents at Glencroft.